Welcome to our today's sensitization, where we want to talk about the type 1 diabetes mellitus. And before we start, allow me be able to create a bit of a background of information about type 1 diabetes mellitus. So in our body, there is an organ called pancreas. And the pancreas plays a key role in the production of insulin. Insulin facilitates the uptake of glucose by the body. So whenever there is a destruction, what we call an autoimmune destruction of the pancreas, resulting to either inability of the insulin to be produced by the pancreas or the partial production of insulin by the pancreas, which is inadequate for the glucose uptake. So the type 1 diabetes simply refers to an autoimmune destruction of the pancreas resulting into either complete inability of production of the insulin or partial production of insulin, which is compromising the uptake of glucose. Now, there are several risk factors to type 1 diabetes, and today we want to have a look at two of them because those are the major ones. One is the age, and type 1 diabetes is very common within the childhood period. It can also take place or occur in all the ages, but very common in childhood. Number two is family. Type 1 diabetes mellitus has got a family linked. So if one or a father or a mother has got type 1 diabetes, chances of the offspring or children developing the same increases. Now, after having looked at what type 1 diabetes is, let us now have a look at the clinical presentation of type 1 diabetes, or in simple words, signs and symptoms of type 1 diabetes. So of course the first thing is that there will be a confirmation or a lab confirmation of either a random blood sugar of 11.1 and above millimoles per liter, or sometimes fasting blood sugar of above 7.0 millimoles per liter. And that can either be accompanied by one, increased thirst, what we call polydipsia, increased hunger or feeding excess, what we call polyphagia. We can have increased frequency in passing urine, what we call polyuria. We can also have unexplained weight loss. So one loses weight that he or she is unable to trace the cause. One can develop fatigue. One can develop what we call blurring of vision, inability to see clearly. One can have slow healing of wounds or even cuts, in case that is the case. Ladies and gentlemen, an individual can also develop what we call recurrent urinary tract infection. That points out or points towards diabetes mellitus. And therefore, should you come across any client presenting with the above that I've highlighted, that client should be taken to the hospital for further screening to ascertain or to confirm the origin of all those symptoms. If you are watching us for the very first time, kindly subscribe and leave a comment. Until next time, it's goodbye from all of us.